Hi guys, welcome back to my channel. I'm Nurse Babe Britt, and in today's video, I'm going to be giving all you new grad ICU nurses tips, tricks, and a few of my experiences that is going to help you excel in this field. So if that is something that interests you, then please stay tuned and listen for more. So if you guys don't already know, I currently work in the cardiovascular/cardiothoracic ICU. That's where I've always specialized. And I started out as a new grad in the CV ICU. This video is applicable to any ICU, whether it's CV, surgical, neuro, it's applicable to all of them. But that is my specialty and my background. And yes, you can work as a new grad in the ICU. I know that is something that if you talk to an older nurse, they might say, no, you gotta do med surg first. That's not true, but that's not what this video is about either. So the first thing that I will say is everything I mentioned to you guys is my personal experience or I have seen it. So the first thing I would say is if you have not already, please try to make sure that you have applied to a residency program at a teaching hospital. Now, I understand that's not always an opportunity that is available to everybody, and that is okay. You will survive. The only thing I would say is the education does vary. I've worked at teaching hospitals. I've worked at nurse-driven hospitals. It does vary in the type of orientation that you get, the type of education you get. So it does vary. Hopefully I have caught you in time and that is something you consider. But if not, that's okay. We're going to keep moving forward. The next thing I would say is remain teachable. That is when you step foot in the door with your preceptor. That is when you get off of orientation, wherever you go as a nurse. Remain teachable because no nurse knows everything. No doctor knows everything. They practice medicine. Keyword, heavy emphasis on practice. So do not think that you know everything, and please do not act like you know everything. And that kind of leads me into my next statement, which is when you get off of orientation, don't think the expectation is for you to know every single thing about that patient population. Because honestly, orientation, however long it is for you, you will only see so much. Every day, doctors and nurses are seeing things that they have never seen in patients before, or they have rarely seen in patients before. So the expectation is not for you to know everything when you get off orientation. So don't feel that way. Also, remain humble. So if you think you know everything, you don't. I'm here to tell you don't. So just get that out of your head and, remain like a sponge and soak up information. The next thing I will say is that the biggest mistakes that I see new grads make is mistakes when it comes to orders. For one, you should always be checking your orders, okay? That kind of goes without saying, right? However, there are times where a patient may be on a medication. Either they don't have an order for, let's say it's an IV medication or, whatever. If there's no order for it, the proper order set is not in place, that is something that you should question. And that is your responsibility to question it. No, you do not put in orders. However, you are checking those orders and you're responsible for that patient. If it's something like a set of labs, if the labs need to be drawn a certain way and you don't know how to draw the labs that way, don't take the shortcut and just do the best way you know how. Ask somebody else. Ask a senior nurse, ask your charge nurse, ask your nurse educator if they're around. Ask somebody else, and preferably not another new grad nurse because they are trying to figure it out just like you are. But ask someone who is experienced. So if they can show you, ask them what does it mean when it says draw from this port and not this port, or post filter, pre filter if they're on like CRRT and things like that. Ask those questions because it does make a difference in the results you receive on those labs. Like it literally does. I've seen it happen. And you don't want to be treating a patient based off of false results because the labs were drawn wrong. When it comes to medications, there are some times where, a patient may be on certain medication, like I said, and maybe you need to be checking neuro checks every hour or blood sugars every hour or urine output more frequently or whatever. You need to make sure that for one, those order sets are in place and that you are doing those things. Even if they aren't in place, there are some things you can still do as a nurse, to make sure that your patient is safe. And so the main thing you should get from that is to look through your orders, look at what's going on with your patient. Does everything correlate? Is everything adding up? Is everything matching? Ask those questions, because a lot of times things go overlooked all the time. Nobody's immune to overlooking something. I've overlooked maybe, a few things. Like, it happens, and sometimes it's not an emergency. It's not something that might kill the patient, but it still is something that needs to be addressed. The next thing I would say is, don't get caught up with the little task to the point where you forget to look at the bigger picture. So what I mean by that is, don't get so caught up in, okay, I need to do Foley care by 8 o'clock, and then I need to chart my assessment by 9 o'clock, and I have to have bathed my patient by 11 o'clock. Like, those are just examples, because sometimes, depending on what hospital you work at, they may say, okay, this needs to be in by this time, or ideally, your assessment should be 8, 12, and 4. Chart in real time. Do all these things. Don't get so caught up in the little tasks that you forget to look at the bigger picture. Keep in mind that it's a human being that is in a bed, okay? So don't get so caught up in that. Also, not only are they a human being that's in a bed, but when you fail to look at the bigger picture, what you're essentially not doing is thinking critically. If you get caught up in the little task and checking boxes off, making sure you did this, you did that, and while those things are important, you have to have good prioritization skills. You have to realize which is more important right now. Is it more important that I address my low blood pressure right now, or is it more important that I address the fact that maybe the patient is at a 4 out of 10 on pain right now? MAP is in the 50s. Pain is 4 out of 10. Which one is more important? Yes, the patient might be saying, look, I really need some pain medicine right now. I really, really need it right now. Yes, get them pain medicine. However, MAP is in the 50s. Pain is 4 out of 10. It's more important to keep them alive. You don't want to get so caught up in, those little task things, especially when your patient is able to tell you, okay, hey, I need this, hey, I need that. It's very easy. I've done it. It's very easy to get caught up in trying to do everything that the patient is currently asking you for, and neglecting to look at the bigger picture and say, hey, you know what? This patient's blood pressure is going down, or the heart rate, the rhythm isn't where it needs to be. I need to address this. I need to address these things first before I continue doing those other things. Like I said, all are important, but you have to be good with your prioritization, and you have to be willing to look at the bigger picture. And the last thing I would say is to be patient with yourself, okay? Working in the critical care setting is intense. It is. Like, I'm not going to sugarcoat it. There are some days you might go home and you might question why you even signed up for it. You're going to have good days. You're going to have bad days. You're going to have, okay days. Like, it happens. That is what it comes with. That comes with the territory. However, be patient with yourself. Even once you get all these years of experience, you will still have some good days and you will still have some bad days. Like, nobody's immune to that. So don't think because you're new to ICU or you're new to nursing and both to ICU that you're just, you're having the hardest time and nobody understands, nobody empathizes with you, and that it's never going to get better. Because it will get better, but you have to be patient. You have to work on the things that have been pointed out to you by maybe senior nurses, preceptors, whatever, that are things that you can improve on. Even when you're giving and when you get report, there's an opportunity right there to do a whole lot of learning, because there are some things that maybe you didn't address, or that you forgot to address, or that you didn't address in the right way, that the receiving nurse or the outgoing nurse or whatever the case may point out to you. That's why I said remain teachable. Even when you're off orientation, it's okay. It's okay. Sometimes, you forget or you might misunderstand something, and it's okay. Be patient with yourself and know that you have chosen to work in a very rigorous and very intense specialty. Specializing in intensive care, it is intense. However, it can be very rewarding as well. So there is a bright side to it. And, when you're at home on your off days, and I've said this in previous videos before, engage in a lot of self-care, take care of yourself, take care of your mental health, your emotional health, your physical health. All of those things are important. Make sure you take care of you. So when you show up to work in this intense environment, you can show up as your best self and set yourself up for the most success. So that is what has personally worked for me. I have been that new grad nurse that was, stressed, didn't know what I signed up for, questioned why I signed up for it. Like, I've been that nurse. Most nurses that were new grads in the ICU have experienced that at some point. So we are out here and we understand. But I do hope that you find this video helpful. And if there's something that I didn't really cover, that you may be struggling with, or you may have a question about, or maybe something you've seen, I am happy to address it. Just feel free to comment below. And don't forget to like, subscribe, turn your notifications on so you can be the first to know when I post my next video. And I will see you guys soon. Thanks for watching.